Before we can understand how ACE inhibitors work, we have to understand how ACE works in the body. ACE stands for angiotensin converting enzyme, and it's part of the renin-angiotensin system, which helps the body to regulate blood pressure, fluids, and salts. ACE is located primarily in the pulmonary circuit. However, it's also found in the vascular endothelium of the brain, the kidneys, the adrenal glands, and the heart. Angiotensin 1 is an inactive decapeptide that circulates in the blood. ACE converts angiotensin 1 to angiotensin 2. Angiotensin 2 is a vasoconstrictor. ACE also degrades bradykinin, which is required for the synthesis of nitric oxide, which is a vasodilator. Angiotensin 2 further impairs synthesis, and it also increases the production of aldosterone. Aldosterone is a hormone that's produced in the adrenal cortex, and it causes the kidneys to excrete potassium, but to reabsorb sodium. When sodium is reabsorbed, water is retained, which increases blood pressure and increases cardiac preload, which increases the chance of having a stroke. Angiotensin 2, as I said earlier, is a vasoconstrictor, which causes increased afterload. Due to the increased afterload, it's more difficult for the heart to pump blood, so it has to work harder to pump the same amount of volume, which causes hypertrophy. ACE inhibitors reduce the activity of angiotensin-converting enzyme, and therefore less angiotensin 2 is produced. Because there's less angiotensin 2, there's less vasoconstriction and a lower blood pressure. ACE inhibitors are often prescribed to patients with high blood pressure and patients with heart failure, and they're used to prevent myocardial infarctions, stroke, and diabetes-related kidney damage. Angioedema is often defined as the localized swelling of usually the face, lips, or tongue. And if a patient has a history of angioedema, that's an absolute contraindication for all ACE inhibitors. Other contraindications include renal disease and pregnancy, because in the first trimester, ACE inhibitors are a class C teratogen, whereas in the second and third trimester, they're a class D teratogen. Medications include captopril, quinapril, lisinopril, enalapril, and benazepril, though there are more. If you'll notice, each medication ends with PRIL. That's how you know it's an ACE inhibitor. Side effects and adverse reactions include angioedema, dizziness, low blood pressure, headache, drowsiness, diarrhea, weakness, cough, rash, and altered taste.